Imagine learning that over 1 in 9 adults worldwide are living with diabetes. In the United States alone, more than 38 million people, 11.6% of the population, are dealing with this disease. The numbers climb even higher as we age. Nearly 3 in 10 Americans aged 65 and older live with diabetes. These statistics are more than numbers. They represent parents, grandparents, and friends whose lives revolve around finger pricks, medications, and constant worry about blood sugar spikes. Have you ever wondered what life would look like if you could take control of your blood sugar in just 1 month? Today's story follows a relatable 55-year-old diabetic patient. Let's call him David. His journey is based on the latest research, insights from doctors and nutrition experts, and real-life application. David lives in a quiet suburban neighborhood, loves cooking for his grandchildren, and has been struggling with type 2 diabetes for nearly a decade. Like many of us over 50, he believed that managing his condition meant endless pills and sacrificing enjoyment. But recent guidelines from the American Diabetes Association, ADA, encourage plant-based proteins, fiber-rich foods, limiting saturated fats, and choosing water over sweetened beverages. These evidence-based recommendations inspired David to design a 30-day challenge tailored to his needs. Before we dive in, take a moment to introduce yourself in the comments. Tell us your age and where you're watching from. Sharing helps build a supportive community, and your experiences may motivate someone else on the same path. Don't forget to like and subscribe to our channel for more in-depth videos that can improve your health. Let's embark on this journey together. Day 1 to 2. Meeting the doctor and facing the numbers. David started with a doctor's appointment. His latest blood work revealed an HbA1c of 8.2%, higher than the recommended target of about 7% for relatively healthy adults. His physician, Dr. Lin, reminded him that HbA1c is a useful marker, but in older adults it can sometimes be misleading. The value tends to rise with age and may not reflect dangerous episodes of low or high blood. Dr. Lin explained that continuous glucose monitoring, CGM, has been shown to improve time in range and reduce hypoglycemia in older adults. CGM devices provide real-time feedback, alerting the wearer to highs and lows, and they have revolutionized diabetes care. Armed with this knowledge, David decided to invest in a CGM. At first, he was skeptical. Would it hurt? Would wearing a sensor all day make him self-conscious? But Dr. Lin shared a 2025 narrative review showing that CGM is particularly helpful for older adults by reducing glucose variability and hypoglycemia. David left the clinic with a tiny sensor on his arm and a determination to treat the next 30 days as an experiment in self-care. Motivational quote, "People with high blood pressure, diabetes, those are conditions brought about by lifestyle. If you change your lifestyle, those conditions will disappear." Dick Gregory, days 3 to 7. Understanding the body and setting goals. What is happening inside? In the first week, David focused on education. He learned that blood glucose isn't the enemy, it's the body's fuel. The real problem is persistent high levels, which damage blood vessels, nerves, and organs. Over years, uncontrolled diabetes can lead to vision loss, kidney disease, and heart failure. Yet, as cardiologist Dr. Eric Topol points out, lifestyle adjustments can put glucose in a healthy range. For diabetes, here's a relationship between lack of glucose regulation and complications. If you can get your glucose in a tight, normal range by adjusting your lifestyle, wouldn't that be great? David set clear goals: reduce his HbA1c towards 7%, increase daily time in range to at least 70%, lose a few kilograms, and improve his energy. Setting up the toolkit. David's toolkit included continuous glucose monitor, CGM, to provide real-time glucose data, catch trends, and avoid hypoglycemia. Food journal, to record meals, snacks, and how each affected his blood glucose. Activity tracker, to monitor steps and physical activity. Studies show that a combination of aerobic and resistance training improves insulin sensitivity and reduces body fat. Support system, family, friends, and an online community for accountability. Takeaway for you. If you're following along at home, talk to your healthcare provider about whether CGM is right for you. It's not just for insulin users. Newer research suggests that even adults with type 2 diabetes on oral medications can benefit from the feedback a CGM provides. Days 8 to 14. Transforming the plate. Embracing an evidence-based eating pattern. The ADA's 2025 standards of care highlight plant-based protein and fiber while encouraging us to limit saturated fats and drink water instead of calorie-laden or artificially sweetened beverages. Inspired by this, David revamped his meals. Instead of processed breakfast cereals, he chose steel-cut oats topped with chia seeds and a handful of berries. Oats are rich in soluble fiber, which slows glucose absorption. For lunch, he enjoyed lentil and vegetable soup with a side of mixed greens and olive oil. Dinner often included grilled salmon or tofu, steamed broccoli and quinoa, reflecting advice from nutrition researcher Dr. Basil Khan that replacing refined grains with whole grains can improve glycemic control. David also learned that hydration is important. Sugary drinks and even diet sodas can sabotage blood sugar goals by triggering cravings. Drinking water and herbal teas kept him full and improved his energy. According to the ADA update, choosing water over high-calorie or calorie-free sweetened drinks is an essential part of a healthy eating pattern. Weekly meal prep tips. Prioritize non-starchy vegetables. Fill half of your plate with colorful vegetables like spinach, kale, bell peppers, and zucchini. Their fiber content helps stabilize blood sugar. Choose lean proteins. Opt for plant proteins, beans, lentils, chickpeas, and lean fish or poultry. Plant-based protein and fiber improve satiety and gut health. Pick healthy fats. Use olive oil, avocados, and nuts. These fats support heart health and keep hunger at bay. Stay hydrated. Keep a refillable water bottle with you. When you crave a snack, drink water first. Sometimes thirst mimics hunger. A 2022 randomized controlled trial involving older adults with diabetes showed that a structured lifestyle program combining behavioral diet and exercise significantly improved glucose control, insulin action, body composition, physical function, and quality of life. Participants started with sessions at a facility and later transitioned to community fitness centers and home workouts. The program combined calorie reduction, increased protein intake to preserve lean mass, and both aerobic and resistance training. Despite their average age of 72, participants achieved an approximately 1% reduction in HbA1c without major loss of muscle mass. This evidence reinforced David's belief that it's never too late to start. Real-life application. During the second week, David prepped meals on Sundays. He cooked a big pot of bean chili, roasted trays of vegetables, grilled chicken breasts, and portioned everything into containers. He included Greek yogurt and nuts for snacks, reminding himself that adequate protein is crucial to prevent loss of lean muscle mass during weight loss. His CGM data showed fewer spikes and more time within his target range. The results motivated him to continue. Days 15 to 20. Moving more and managing medication, exercise as medicine. David had always thought of exercise as punishment, hours on a treadmill. But research shows that combining weight loss with aerobic and resistance training leads to the greatest improvements in physical function and body composition. He started with daily 30-minute walks, gradually adding light strength training using resistance bands and small dumbbells. Twice a week, he tried chair yoga to improve balance and flexibility. Gentle movement also reduced stress and improved his sleep. He discovered that exercise sessions after meals lowered his postprandial glucose. Short walks after eating help muscles use glucose for energy. This strategy is supported by experts such as Dr. Kenneth Poole, who emphasizes that even 10-minute walks after meals can improve insulin sensitivity. David's CGM showed smaller glucose peaks, reinforcing the habit. Medication adjustments. As his blood sugar improved, David experienced mild hypoglycemia during exercise. The lifestyle intervention trial noted that increased activity can cause more low blood sugar episodes in people on insulin or insulin secretagogues. David returned to Dr. Lin, who reviewed his glucose logs and adjusted his medication dosage. They also discussed the ADA's updated recommendations for certain medications, such as GLP-1 receptor agonists, which protect the heart and kidneys in people with type 2 diabetes and chronic kidney disease. Although David's kidney function was normal, they decided to keep these options in mind for future discussions. Dr. Lin also mentioned that patients with metabolic dysfunction, associated steatotic liver disease, MASLD, may benefit from dual GIP/GLP-1 receptor agonists. The physician emphasized that medication decisions must be personalized, considering comorbidities and patient preferences. David appreciated the collaborative approach. It reminded him that medication isn't a failure, just another tool in the toolbox. Stress, sleep, and support. Halfway through his challenge, David realized that stress and sleep affect blood sugar as much as food. He began a nightly routine of deep breathing exercises and journaling to release worry. On weekends, he visited his grandchildren, which raised his step count and boosted his mood. Emotional connection matters. Social support helps maintain healthy behaviors. David's spouse joined his walks, and they discovered local support groups where members shared recipes and encouraged one another. This social network became a crucial part of his success. As diabetes advocate Paula Deen once said, "I was determined to share my positive approach and not let diabetes stand in the way of enjoying my life." David embraced that message, laughing more often and appreciating small wins. Days 21 to 25. Tracking progress and celebrating wins. By the third week, David felt lighter, both physically and mentally. His CGM data showed that he was hitting his time and range target 75% of the day, up from 50% at the start. He lost 3 kilograms and his blood pressure improved. These improvements weren't just numbers. He noticed that his energy levels were higher, his sleep improved, and his mood lifted. Lessons learned: monitor regularly. Checking CGM readings multiple times a day allowed David to see patterns and adjust meals or activity accordingly. Don't fear hypoglycemia. Mild episodes are manageable with quick carbohydrates, but always consult your doctor when adjusting medication. Hydrate, hydrate, hydrate. Drinking water helps regulate hunger and supports kidney function. Celebrate small wins. Each improved statistic is a victory. Share it with loved ones or in the comments below to inspire others. The 2022 randomized controlled trial referenced earlier found that lifestyle intervention improved beta cell function, reducing glucotoxicity and lipotoxicity. These improvements were attributed to decreased body fat and increased fitness. In simple terms, losing fat and gaining muscle helps the pancreas work better and lowers blood sugar. It's a reminder that our bodies are resilient and can heal with the right support. Days 26 to 30. Reflection and next steps. As the challenge neared its end, David scheduled another appointment with Dr. Lin. His new HbA1c was 6.3%, down nearly 2 points, and his doctor was thrilled. They discussed next steps: continuing the eating pattern, gradually increasing exercise intensity, and staying consistent with CGM monitoring. David realized this was not a temporary diet, but a new way of living. He also understood that maintaining health involves regular checkups and open communication with healthcare providers. Dr. Lin reminded him that some people might qualify for GLP-1 or GIP/GLP-1 receptor agonists or other medications, particularly if they have kidney issues or liver disease. The key is tailoring the plan to each individual's needs. Motivational quote: "The way to deal with the devil of obesity and diabetes is literally one day at a time." Stephen First. David realized that sustainable change comes from daily choices, not drastic overnight transformations. If you've been inspired by David's journey so far, tell us what small change you'll make today. Will you swap soda for water, add a 10-minute walk after dinner, or try a new plant-based meal? Share your plan in the comments. Remember to like and subscribe to stay connected. Your interaction signals to YouTube that our research-based content is valuable.